Hi, so today we're going to talk about posture. It's a really important topic, and all the exercises that I do is all about strengthening the core and getting strong musculature around this sort of trunk area. And what I'm noticing is that through sort of poor postures where people are sitting a lot, maybe they're sort of on their devices where their heads are down or kind of sat in that kind of kyphotic position on Xbox or PlayStation, what I'm noticing is we are getting weaker around this trunk area, and all our core muscles are just not as strong as what they used to be. We used to have a really active lifestyle. Jobs were active. We used to do more around the house. We used to be carrying and lifting and sawing and chopping. And now everything is just easy with a press of a button. So that is affecting our strength of our core, the strength of the muscles all around our trunk, our back. And what we're finding really is that it's affecting our posture and affecting just how we hold the skeleton. So when we think about posture, we should be thinking about the alignment of our pelvis, where our pelvis is, having that S-shaped curvature. So you have a slight curvature going in at that lower back area. It goes out slightly thoracic and then in again at the neck. But the head is on top of the spine. But what I'm finding a lot of is that the head is now coming forward. So either tilting forward like this or protracting forward like that. Sometimes then with a kyphotic, like a rounded thoracic spine. So you're getting this roundness and the hunched shoulders and the head is forward. So those kind of postures are quite common now because of technology and using technology. And also from your pelvis point of view, it's quite common to have what we call a sway back posture, where your pelvis is shifted forwards. So your pelvis is too far forwards and you're sort of leaning back and hanging on your ligaments there. So actually your pelvis isn't in alignment with your shoulder and your ankle. So when we think about alignment, if I just step over a little bit, if we're thinking about the ankle bone, the knee, the hip and pelvis, all the way up to the shoulder and the head. So everything is in one straight line there, but you have got the S shape of your spine. So the S shape of your spine, but those joints are all in alignment. So if you find that one is further forward, like this, or like this, then that is going to contribute to, it can contribute then to other issues. So neck pain, shoulder pain, back pain, even as far as, we see people with knee issues, ankle issues, Achilles, calf. It all is contributed to where you hold yourself here and being strong in your centre, being able to hold your skeleton upright in its neutral position. So what I want you to try and do, first of all, to achieve that position, if you just have your feet hip distance apart, and all I want you to do, first of all, is figure out where are you standing on your foot. So do you tend to have your weight on your heels? Is your weight on your toes? Is your weight on the outer edge of your foot? On the inner edge of your foot? Where is most of your body weight? So maybe just stand, have a little sway around and just see, actually, where do I hold myself? What you're aiming for is to be in the center of your foot. So you've got equal weight distributed around the foot. Okay, so you're not on your heels and you're not on your toes. And you can feel, if you were to sway yourself forwards and back like that, you can actually feel how when you come to the back of your heels, you actually engage more of the muscles at the back. When you come to your toes, you're actually engaging the muscles through the front of your leg. So when you're in the center of your foot, you're recruiting muscles front and backs of your legs, so all the way up. So they're all contributing to you standing, okay? Then we don't want to lock out our knees, because again, this is something that I'm seeing all the time, is hyperextension of the knees. So really locking your knees out, and sometimes you'll even see a curvature going the other way. So knees should be soft, so not bent, but just soft. And then when it comes to your pelvis, if you put your hands on your pelvis here, so your bony bits, and just tilt your pelvis forward and back. So you're trying to stick your bottom out and create a curvature here, and then you're trying to tuck the tailbone underneath you where you feel your buttocks clenching and feel like your pelvic thrusting. So as you go forwards and back with your pelvis, you should rest the pelvis then in the middle where it doesn't feel like it's going forwards or it's going back. And then the ribs, when we come up to the ribs, we're keeping the ribs in and down. So we're not flaring and elevating the ribs, because I think a lot of misconception with posture previously has been stand upright, shoulders back. So we've been in a position where we're overcompensating, shoulders going right back and your chest is elevated, so you're raising up the thoracic. Now when you do that, that affects how you breathe. You can't engage the diaphragm properly, you're overusing your back extensors at the back, and it's actually switching off your core, and you're not able to really engage your core properly when you're hyperextending. So this could be people who are trying to be upright, too upright, and squeezing the shoulders back. Or I've also seen a lot of that posture with people who've done dancing and gymnastics and they've overcompensated. But as you can see, when the thoracic spine, when this chest elevates, naturally your pelvis then goes into anterior tilt. So when the chest comes up, because you're moving your spine and the spine is attached, the thoracic spine is attached to your lumbar spine, it will then have a knock-on effect and you'll end up tilting your pelvis forward with this chest elevated. Okay, so when we come to that chest area, we want to think about having the chest relaxed and the ribs depressed here, but the shoulders are in alignment. So shoulders back, we're just thinking about that squeeze here rather than squeezing the shoulders and then elevating the ribs as well. So keeping the ribs nice and relaxed here, the chest nice and relaxed, and it's just that gentle squeeze between the shoulder blades, as if you're balancing an orange between your shoulder blades. So you're just trying to balance the orange there. You're not trying to squeeze it, you're just trying to balance it. And then the head position, obviously head on top of the spine rather than forwards and chin poking forwards. So think about bringing that chin in and having your head on top. So you want to feel like you've got length going through the back of your neck, bringing that chin in there. The other way that you can try to actively stand and recruit all these muscles is imagine that underneath both feet you have a bunch of grapes and you're squashing the grapes into the floor. So as you squash your grapes downwards, you'll naturally find that your muscles will engage. So as those muscles engage, the front, the back, the core, the glutes, you'll feel quite active and engaged in your muscles from the waist down. You don't want to hyperextend your knees though, so when you are squashing your grapes, it's not about hyperextending your knees. You're still keeping your knees soft and you're still keeping your body weight through the midfoot. So you're not putting your weight through your heels or your toes. To try and get engagement of front and backs of legs, you want your weight into your midfoot. So when we actively stand, we should feel like muscles are working from our waist down, but actually the shoulders and the chest is actually quite relaxed. I think we tend to use our shoulders and our backs a lot more for holding ourselves upright with posture. So if we can get that more relaxed position and change our head position, then you're going to have a really good posture and you're going to be in alignment. And once your spine is in alignment and your skeleton is in the right place, all the muscles can work effectively, okay, and efficiently. And that can help to obviously prevent injuries and prevent pain. So if you find that you're really struggling with getting into that posture, a little tip that you could try and do is go against a wall. Can you put your heels against the wall? Can you touch with your bottom as well? Touch with your shoulders and touch with your head. So when we stand against a wall like this, you should be able to still fit a hand through that lower back there, so that there should be a gap there, but you should be able to feel your head, the back of your head, so you know where that bony bit is at the back of your head, you should be able to feel that against the wall. and get your shoulders there and your feet or your heels against the wall. So if you find you go against the wall and your head is nowhere near or your shoulders are nowhere near, then you might want to work on that. So you might want to use this as an exercise to try and get your posture better. If you find that you're tight through the chest here, then doing an exercise where you're sort of opening up the front part of your chest, putting your arms into like a cactus arms. We should be able to have our the forearm flat against the wall in this position. So that's quite a nice sort of stretch to do, that you can either do against a wall like this, or you can do it lying down. So if you lay down flat on a mat or the bed and you actually put your arms in that position. So you want to be able to have your head touching, your forearms touching. And that's quite a nice stretch if you've been on a computer or on a device where you're getting quite tight and sort of rounded in your thoracic. So you're doing the opposite sort of movement to that. So that can really help. And again, like that retraction of the neck. So if your head is forward, bringing that chin in to almost feel like you're making a double chin. So that exercise, that retraction, is really good for trying to get posture. So when you do that, you're just aiming maybe to hold it for 5 seconds and then release. But it's a forward and backward movement, as opposed to when you come in, don't be tempted to sort of look up. Yeah, so it's directly in to feel length at the back. So those two movements can really help to, strengthen. So those muscles will strengthen your neck. That will open up the shoulders and get a bit more mobility through the thoracic spine. As I said, with your pelvis, getting pelvis position. If you're strong in your legs and you're engaging your legs by feeling like you're squashing your grapes, then that will position your pelvis in the right position as well. And that, when you're doing that, you can't then, end up hip pitching where you're sort of, going like hanging on your ligaments. So when we do this, when we stand like this or we stand like this, we're just hanging on our ligaments. So actively standing, recruiting the muscles, you'll find that your posture will improve. And it's just a case of practice. Practice makes perfect. Keep doing it, keep doing it, keep doing it until your posture changes. Obviously, I do have exercises here that are going to strengthen your core. So if you're struggling to have that core strength to hold your skeleton in place, you may want to try some of my exercise classes. So there's ones that are free here on YouTube, but I also do in-person ones and ones online as well. So you can check those out. And there's also, with my little morning routines and stretching routines, there's also mobility and flexibility ones if you're finding that actually you struggle to get into that position because of stiffness. So we need mobility. We need mobility in the mobility in the joints. We need flexibility in the muscles, and we also need strength. So we have to look at all 3 elements to be able to maintain good posture. I hope this has been helpful, and maybe you could share this with your friends and family. I think, we all know people who could improve their posture. I've got 2 teenagers, so I'm always talking to them about posture. So yeah, maybe share this video with your loved ones, and thanks for watching.